All right, so the last video we talked a little bit about the IT band syndrome, a little bit of the anatomy that's involved, and kind of the idea of whether or not you should stretch this area and what are some ways to do that if you want to put a little bit of input. Does foam rolling help? Should you stretch it at all? Is a little bit of soft tissue work? You know, what's involved with IT band when it comes to mobility work, seeing how it's more of a big tendon as opposed to a large muscle. So if you haven't seen that video, go ahead and watch that. But today, for today's video, I want to talk to you a little bit about some of the exercises that we do for our patients who come to see us with IT band syndrome. Now, there are some patients who come in who start at a really low level with this, and we give them maybe a little bit easier exercises. But today I'm going to kind of give you sort of the mid-grade ones, meaning like these are pretty common ones that people aren't at their weakest, but not the most advanced either. So kind of right in the middle. And let me show you the first one. We're going to go over 4 today. The first one is a bridge that involves some core activation, okay? So with this exercise, basically you're going to lie down on the ground like this, take a band, pull it forward like this to get some core activation, lift your head up, and then you're going to bring this leg up if we're working the right leg, and I want you to bridge up and at the same time push your leg out to the side. And you're going to do that, hold that for about 15 seconds, and you're going to do that 5 rounds. And the idea is you really want to feel it here right in the middle of the glute and off to the side a little bit, right there, okay? So that's the first one. That's just a way to get the IT band, which is connected to the glutes, into your hip and into your core, that whole area connected, working together to get a lot of strength and just initiation of those muscles in that area. The next one I want to show you is a Bulgarian split squat. So this is another one that involves just loading that hip. You're going to start with your feet about this far away from the box, step back so your toes on the box. You're going to lean forward a little bit. This gets you a little bit more into the glute on that right side. If you're a little more straight up and down, you're going to feel it more in the knee and the quad, which isn't bad, just a different way of doing it. So lean forward a little bit there, and then you're going to go up and down, just like that. Now, as you're doing this, make sure again that your knee is translating directly over the front of the toe. What I don't want to see is this kind of coming in this way, like your knee going that direction. So nice bent over, hinged at the hips a little bit, going up and down, feeling that in the glute and the hamstring on the right side. This one you would do with probably medium to heavier weight, and I would do around 4 to 5 sets of 8 to 10. All right, the next one I want to show you is has to do with your hip flexors. So the TFL, the way it comes up here, and it's on the side, it's like directly right here at this angle. It's like not on the front, not directly on the side, somewhere halfway in between. But because of that, it often, when it is overutilized, especially if somebody's feeling it up here a little bit higher, it's because you're using it for your hip flexors, right? You're getting that muscle to come in and use the hip to do hip flexion when that isn't necessarily what it's used for, right? And so to offset some of that pressure to strengthen around it, so to speak, you want to work on the hip flexors. So there's a ton of exercises to work on your hip flexors. This is one of my favorites, especially for some of our runners, because you kind of incorporates an upright posture. And you're basically just going to march, going up and down like this with a band around your feet. Now the key with this is to really concentrate on doing the work with the front of the hip. A common way that people kind of do this wrong is they sort of like hike the hip up like this, right? See how I'm hiking my whole pelvis up, doing that, right? So you're using your back. Instead, just make sure that you're always just using the hip flexor itself and feeling it there, right in front. And obviously, depending on how tight the band is, you would determine some of the how hard it is. But that one you want to do a little bit more as far as the fatiguing, so doing more like 20 to 25 reps for 2 to 3 sets. All right, so the last one we tend to train as people are getting better is to add a little bit of explosive movement into it, because the IT band does have an action of sort of, especially with running type things, of like catching and releasing, not necessarily catching, I guess that'd be the wrong term for it, but basically storing and releasing energy. That's what I meant to say. And so working on that a little bit to make sure it can handle that load is really important. So we do this thing called skater jumps, which is basically you're just jumping from one leg to the other, making sure you're stabilizing it. Again, knee pointing forward, back and forth, just like that, okay? And so that would be the fourth exercise. And again, that's more of a fatiguing type exercise, to doing like 10 on each side, 20 reps total, 2 to 3 reps. So if you're experiencing some IT band pain, these 4 exercises are a pretty good place to start. And you should start getting some relief just by doing these 2 or 3 times a week. And hopefully it'll take care of some of that pain alongside the knee. If you have any questions, don't hesitate to reach out, and we'll talk to you again soon.